you're going to introduce yourself to your patient. Let them know that you're the nurse taking care of them today. And then I will usually tell my patient, I'm going to grab a set of vital signs on you, and I'm going to do a quick assessment and listen to your heart, lungs, and belly if that's okay with you. Okay? And I mean, I've yet to have anyone tell me no. So, okay? So you get your set of vital signs, your full set, your blood pressure, your heart rate, your respiratory rate, your oxygen saturation, and your temperature. So be sure that you're doing that when you come in to do your general assessment. Be sure you're doing your opening and closing protocols. So opening, you're introducing yourself. And then I'm going to ask, would you mind verifying your name and date of birth for me? Because I want to make sure that I'm in the right room with the right person, okay? So they're going to verify their name and date of birth. So you've introduced yourself, you've done your hand hygiene, you've verified your patient using 2 identifiers. You've told them what you're going to do, so you've explained the procedure, and then you're going to move into your assessment, okay? So, Mel, I'm going to listen to your heart and lungs first. And just when you feel my stethoscope touch, if you'll just take a nice deep breath for me, verbalize that you would do this with the stethoscope directly on the skin. That way, whoever's checking you off in your general head to toe knows that you know this should be directly on the skin, okay? So I'm gonna listen to 6 places for your lungs on the front, and then when I'm done on the front, I will listen to your lungs on the back, and I'll listen to 8 places there on your back, okay? And if you start to feel dizzy, you just let me know. You can definitely pause. And then remember, you go straight down in that ladder pattern. You're listening to those lungs. Okay. Now, Mel, I'm going to listen to your heart so you can just breathe normal. So remember, I'm listening here. What am I listening for? Yep. And then we come across here. It's my mitral. You're my irregular heartbeat. And then we're going to come here. Now, since I'm here, remember, go ahead and flip it. We're going to listen on our way back up. Good. Now, if this is my patient that's lying in a hospital bed, I'm going to tell them that I'm going to go ahead and listen to their belly before I have them like start moving around or anything, okay? So I'm going to come down here, Mel, and I'm just going to listen to your belly real quick, okay? And so Mel is lying down in the bed, and I'm going to listen in all 4 quadrants. Now, while I'm listening to her belly, my mind's already gone to, I'm thinking, okay, Mel, can you tell me when you had your last bowel movement? You don't really have to tell me. But you're going to ask, can you tell me when you've had your last bowel movement? Okay. When did you go pee last? Do you have any burning when you go pee? Okay. Do you have any urgency to pee? So see how when I'm down here in this abdominal area, my mind's already kind of gone to that, right? Okay. Then you can take, we're not going to percuss the abdomen, but you've already got your patient lying there on your bed and you've listened to their belly. So now I'm just going to tell her, I'm going to lightly palpate your abdomen, okay? Or I'm going to lightly press on your abdomen, because Mel's a lay person. She might not know what palpate means, okay? So I'm just going to lightly press on your abdomen. Let me know if you have any pain anywhere. And then you're just kind of palpating in the 4 quadrants. It is not necessary for you to go deep palpation, because you're really feeling for liver and spleen and stuff like that I feel is more advanced. What I want to see out of you guys is that you're lightly palpating that abdomen and you're noting any pain or discomfort that they might experience in that belly, okay? Still have her laying in the bed, okay? So now I'm going to work my way. I'm going to say, all right, can you do me a favor, Mel, and squeeze my fingers real tight? Good. Can you look at me and smile? Can you stick out your tongue? Can you raise your eyebrows? Excellent. Do you know where you are today? Can you tell me where you are? University of Wyoming. Excellent. Do you know why you're here?
Yes,
Good, beautiful. And so then I'm gonna come down to the edge of the bed. I'm gonna lift up their gown or their pants. I'm gonna assess their legs, and I'm looking for color, and I'm checking to see if they have any edema, okay? While I'm down here, posterior tibialis pulses, dorsalis pedis pulses. Then I'm gonna say, hey Mel, can you bring your toes to your nose? So that's that resistance. Now can you push on the gas pedal for me? So do you see how that kind of systematically works your way down, right? Now that I've done all of that, I'm gonna say, all right, now Mel, if you can do me a favor, if you're able, I'm gonna have you sit up in the bed. And I'm gonna come back up here and I'm gonna listen to my lungs. I'll get you to turn this way just a scotch. So when you feel my stethoscope touch, I want you to take a deep breath. If you get dizzy, it's okay to stop. Good, awesome, you can relax. With a patient that's in the hospital, while you're back there, you know, we've got these beautiful gowns that tie in the back. You can assess their skin on their back, right? While you're back there doing that, okay? And you can see whether they've got any scratches, lesions, bumps, anything like that. Oh, the one thing I forgot to do in my systematic was check my radial pulses, sorry, okay? So normally before I do squeeze my fingers or right after, I'll go right to radial pulses, and I forgot that piece, okay? So add that in there when you're watching it. That is a basic bedside nursing assessment that by the time you guys get to the end of this next upcoming year, your junior year, you guys can probably knock that out in a little over 5 minutes or so, okay? Now the things that you need to add to that for this. Okay, so you've performed your hand hygiene. There's not going to be any PPE. Provide privacy. You're going to be in exam rooms. Okay, so there's your privacy. Be sure you greet your client. Don't just walk in and start doing stuff with them. Be sure you walk in, you introduce yourself. Okay, be cordial. How's your day been? Okay, introduce yourself. 2 identifiers. Can you tell me your name, date of birth, please? Ask them if they have any allergies. So that's something that you need to kind of commit to memory to make sure that after you ask them, you know, can you tell me your name and date of birth? They tell you. Are you allergic to anything? Okay, because you don't want to just know meds. You need to know environmental as well, right? If they're allergic to bees. Tell them what you're going to do. Mel, I'm going to do a quick assessment. I'm going to take your vital signs. I'm going to listen to your heart, your lungs, your belly. Have you do a few things for me to assess your neurologic and your musculoskeletal status, as long as that's okay, right? Ask them be sure you perform that orientation piece. Ask them if they know where they are. So she's already told me her name and date of birth, so I know she's an oriented person. And then I asked her, do you know where you are today? Yeah, well, a lot of people can tell you, yeah, I'm at Ivinson. Well, can you tell me why you're here? And they have no clue, okay? And maybe it's because they know they're at Ivinson, but maybe they have dementia and they don't really understand why they're there, okay? So you need to probe a little bit further than just, do you know where you are? Yes, don't ask closed-ended questions. Ask open-ended questions. Where are we today, okay? You got your vitals. That's not a problem. You guys have got that. That general survey of the client. So remember, that's just that initial, when you walk in, I can see that Mel is, and you want to verbalize this to us, okay, because we're behind the glass. So you want to verbalize. So I can see that Mel appears well nourished. She's dressed appropriately for the weather. I don't see any, like, she's not disheveled. I don't note any abnormalities in the general assessment of Mel, okay? Facial movements, so that symmetry of the face, ask them to smile, ask them to raise their eyebrows, stick out their tongue, okay? You're checking facial symmetry. open their mouth and say ah. Remember, we're looking at the uvula. Apparently we're not assessing the that soft palate back there, okay? So open your mouth, say ah, and you're looking at the uvula, okay? When they do that, are their mucous membranes pink and moist? So you're gonna wanna tell us that. You're gonna say, Mel, can you open your mouth, stick out your tongue and say ah, and then I'm gonna say the uvula is symmetrical and the mucous membranes are pink and moist, okay? Assess for pupils being equal, round, and reactive. What tool do you need to do that with?
Pen light.
Pen light, don't forget to bring it. Don't forget your stethoscopes. Pen light, so you're gonna shine the light, you're gonna come to the side and you're gonna shine the light in this eye and you're gonna make sure that that pupil constricts. You're gonna shine the light over here, you're gonna make sure that pupil constricts, and you're gonna make sure that those pupils are equal when they do that. Equal, round, and reactive. And accommodating, okay? So then you would verbalize, Mel's pupils are equal, round, reactive, and accommodating to light, okay? That way we know that you have assessed it and that you know what you just did and why. In looking at her, I can tell that her trachea is midline. Watching her breathe, I can tell that she has equal rise and fall of her chest. Okay, skin is pink. She's not jaundice. Jugular venous distension. I don't think we talked a whole heck of a lot about this, but when you assess for JVD, when you have her laying back and you're doing all that first initial assessment, you can ask her. So let's say you've got your stethoscope out, you listen heart, lungs, belly, maybe you palpate the belly, and then you can come back up and you can ask her, you want her at a 45-degree angle, and you can say, Mel, can you turn your head to the left for me? Good, now can you come over here and turn to the right? I don't note any JVD, okay? Any enlarged lymph nodes of the head and neck. So subjectively, I could ask her, have you noted any like abnormal bumps or lumps in your neck or the back of your head? Because that's subjective, right? So that's the part you're gonna do, is that subjective piece. If you wanna palpate lymph nodes, rock on. I mean, a lymph node's gotta be pretty big for me to feel it. But if you guys wanna practice that, that's fine, either way. What I want to note is that you have asked them, do you note any lumps or bumps in your neck, on your head, that you're concerned about, okay? Upper extremities, you're looking to make sure there's no edema, you're looking to make sure the color is good, there's no cyanosis. When you have her squeeze your fingers, you can ask her to splay out her hands like this. You're looking to see if there's any clubbing or anything in the fingertips. And remember, clubbing and barrel chest is caused by what?
Chronic hypoxia.
Chronic hypoxia. Chronic hypoxia, okay? Radial pulses, hand grip, we checked. Lower extremities, same thing. You're checking for any edema, any wounds, any discoloration, okay? You guys in Cottonwood coming up, you're gonna see patients with a lot of peripheral vascular disease. So they've got a lot of discoloration in their lower extremities. You'll see that on Wednesday. Note the temperature and the color of the skin. Dorsalis pedis, posterior tibialis, foot strength. Pull your toes to your nose, push on the gas pedal, okay? Lungs, we've already listened, okay? Inspection, no barrel chest, equal rise and fall. Have you had any problem, have you had any difficulty breathing, or have you had a chronic cough recently, okay? Make sure you ask that. If they have a cough, what else do you want to know?
Sputum.
Sputum. Are you spitting anything up? What color is it? Okay, because we're gross like that. Cardiac, you're going to note any abnormalities in the pulses when you feel pulses. Where would you listen for an apical pulse? Over the apex of the heart, which is what I consider down what I would say the base, apex of the heart, right? You absolutely must listen over the 4 areas of the heart, and you must flip your stethoscope over and listen with the bell as well. I don't care if you do it backwards or if you flip your bell and come back up here and do it. It doesn't matter, but we just need to see that you assess with both, okay? And then when you assess, I want you to be able to verbalize. Obviously, like with Mel, I wouldn't say regular. I would say, irregular heart rate, but you guys need to verbalize that there are no abnormalities heard, no murmurs, S1, S2, heart rate's regular. Okay? You would want to ask if they're having any chest discomfort, any chest pain, and you need to note where to count that apical pulse. So don't forget that, okay? And if you need to add that while you're doing all patients take meds, and then say, now I'm going to listen for the apical pulse over the apex of the heart, and I'm going to count for a full minute, okay? Now I'm going to listen with the bell of my stethoscope and assess for murmurs over all patients take meds. Does that make sense? Abdomen, note if, oh, Isaac.
You want us to sit there for a full minute?
I want you to verbalize it,
Okay.
but you don't have to do, because yeah, no. I think I've got, I forget how long I allotted for 2 students to do an assessment, but I want you to verbalize it. Now I'm gonna listen for the apical pulse and I'm gonna count for a full minute, okay? And I'll make sure the faculty that's helping with checkoffs knows all this too. I'll debrief all of it, or pre-brief or whatever, all in on it. Inspect your abdomen, listen and palpate. If we see you palpate the abdomen first, before you listen, then you probably will lose points in that area, okay? So just be sure that when we're talking about the belly, be sure that you're listening first, okay? When was their last bowel movement? Do they have any constipation or diarrhea? Any burning with urination, okay? And that's kind of it, the assessment part, okay? And then you're like, Mel, thanks so much for letting me take care of you today. Do you have any questions at all? I'm gonna make sure that Mel's bed is in the low and locked position. I'm gonna make sure that she has her call light and that her tray table with all of her belongings is where she can reach it. If you need anything, Mel, be sure and hit your call light and let me know, okay? And don't get up out of bed without calling me, okay? Because that's when your people are gonna fall. Be sure you thank the person for letting them take care of you today. I know it seems kind of silly, but it kind of means a lot. You know, thanks, especially as a student, right? You're going into someone's room to practice nursing on them, right? So thanks so much for letting me take care of you today, okay?